do you organize your day? Question from a new nurse practitioner who is having difficulty organizing their day at the beginning of their day. They're getting overwhelmed with the amount of information that they're presented and the amount of information that they have to absorb in order to care for their patient load effectively. They get lost in the madness. As a new NP, you have to figure out what works for you. First of all, welcome to the club. I was equally overwhelmed, and you will continue to be overwhelmed for probably a number of years. It's parallel to when you were a brand new nurse. It's going to take some time. When you started as a brand new nurse, you were all over the place. Your efficiency was horrible. You ran in and out of the rooms nonstop. You backtracked. You doubled over. You reviewed. Then you questioned and went back and did it again. You probably looked at the same thing 3 or 4 times. Probably went into the room 3 and 4 times for the same intervention or to check on the same thing. It's all part of the learning process. If I could give you 2 pieces of advice on how to organize your day or to develop your own plan of attack, there's 2 things that helped me in the beginning. The first is to treat every patient, regardless of how long they have been with you, your service, in the hospital, or in your clinic, or at your office. This can apply to any nurse practitioner in any setting. You want to follow the acronym ADPI. Hoping that I'm not the only one that had to learn this acronym. ADPIE, ADPI. So it's admission, diagnosis, plan, intervention, and evaluation. And that's a rudimentary beginning level acronym for how to admit someone into the inpatient setting. So then maybe it is, very specialized in my area of practice. I think it can apply to everybody though. Each patient comes in, you need to find out what is their admitting diagnosis. What did they come in with? You're looking at admission diagnosis, then you're looking at diagnoses that they are being treated for, not only acute but chronic problems. ADP is your plan. P, what are you doing? What are you doing for this patient? Are you just observing them because they're having chest pain, or are they in the intensive care unit on a bazillion drips, intubated and have like every machine known to man in the room? So there's varying levels of acuity. What are you doing for them? Because ultimately they're in your care. So what's your plan? Intervention are the things that carries. How are you carrying out your plan? What are you doing? Are you ordering labs? Are you ordering radiographic imaging studies? Are you ordering outpatient testing? Are you ordering some sort of special exam? Are you ordering a special diet? Are you doing education? List is endless. Intervention, and then E is evaluation. You're evaluating not only the patient in their current state, but you're evaluating your intervention and your plan. Did it work? What's the next step? Are you starting over? Did you accomplish what you needed to accomplish? You will constantly revisit the beginning of this acronym, maybe a bazillion times throughout a single day or a single shift, because it's an easy way to assess and reassess your patient and where they are in the admission, transfer, discharge echelon of care. I think everybody has heard the ATD, admission, transfer, discharge. You should be, when are you planning discharge? At what point do you start planning the discharge of your patient? On the day of admission. kind of the same thing whether it be outpatient or inpatient. What are you planning for your patient? How are you going to accomplish it? And did it work? The second way that I would recommend planning your day for each individual patient, it's a simple cheater method. In my area of the world, we have an electronic medical record called Power Chart. It's called something different for everybody. On the left-hand side of the screen, when you open a patient's chart, on the left-hand side of the screen are a series of tabs. Each tab opens up a new menu. The first menu is your order tab. Then you have your medications tab. You have your I's and O's. You have your lab tab. You have a series of tabs that go down the list. And I quite literally, as a new NP, I started at the top of the list and I clicked on every single tab on my patient when I started my day. How long you spend on each individual section is entirely up to you, and it will vary based on your experience, your expertise, your confidence, as well as the patient's acuity. Some patients don't have a whole lot of lab work that needs to be reviewed, or they have lab work that's all normal or within normal limits. Some patients didn't have radiologic imaging tests. Some patients didn't have other interventions. Some patients only are on 2 medications. Some patients are on 30 medications. So you have to barter your time accordingly. In the beginning, you're going to be super slow. Think about it when you were a brand new nurse. How long did it take you to assess 1 patient, let alone 5 patients if you're on a med-surg floor or if you're in a nursing home? How long it took you to get through your assignment? And then you had to go back and do it again. Everything that you do is going to be at a snail's pace when you start. But that's all part of the learning process. Don't let anybody threaten you or intimidate you into thinking you're going too slow. You should get a little more efficient each time you do it. Please don't cut corners, don't take shortcuts. Pick a method that works for you and stick with that. I guess if I had to give a bonus suggestion, would be to flat out ask your colleagues. Ask the docs you're working with. Ask the NPs and the PAs you're working with. Ask anybody who has more experience than you, which in most cases is virtually everybody when you start. Ask them how they're doing. Hey doc, when you start your day, when you open up a patient's chart, what do you do? How do you do it? It's very interesting sometimes to see how a physician, someone who's trained in medicine versus nursing, to see how their mind works and how it develops and how they navigate through patient care. And it will probably confuse you in the beginning, and there will be a lot of things that you absolutely don't want to do because it just will slow you down and make things worse. But you'll be surprised how much you'll pick up and how many tips and tricks you can acquire by asking people who don't share your experience in any way, shape, or form. At the end of the day, this is completely normal. It will take time. Best of luck.